Hello. So, this is Janine. You like to be called Jeannie?
No, or just whatever. Janine's fine.
Okay.
Yeah, you can call me Jenny.
And we are going to be talking about craniosacral therapy.
Yeah.
And so, how did you get into this type of therapy? What drew you to it?
I think I started doing Reiki when I was in my mid-20s as a facialist, and that sort of opened me up to energy work, and that and I realised how amazing it was, but I was searching for something else still, something that wasn't maybe quite so esoteric, that I could do to kind of treat the masses with, if that makes sense.
Yeah.
Or and so I read an article about craniosacral, and I thought that sounds amazing, and I liked it because it had that real anatomy and physiology, and that it had the technical stuff and that kind of theory behind it that I thought would be really easy to introduce into my work. And so after reading that article, not long after that, I happened to bump into someone who was training in craniosacral, and she was looking for case studies.
Oh wow!
I know, it was like one of those little synchronicities.
Yeah.
So I jumped at the opportunity, and when I went and had a treatment with her, I could just feel it felt so similar to Reiki. It just felt like energy, but it was just almost like in a different template, I guess. And I just loved it, and I had a few more treatments with her, and then I thought, right, I really want to study this, so I went and saw her tutor, or one of her tutors, and had an amazing experience with him. And so then after that I decided, right, I've got to learn this. I had ended up having 5 sessions with him, and what I was experiencing at the time when I had it was I was very stressed. I was very angry.
Yep.
I was very run down. I kept getting sinus infections all the time, and it was sort of the first period in my life where I really felt just totally out of sorts, or to that extent. And after about 5 sessions, I just felt like a completely different person. So
wow, that's interesting. So
yeah.
What I've kind of read about it and heard about it is that often with people that have PTSD or have suffered a trauma, you are sort of in that heightened state of fight or flight, and that your brain is kind of putting your body into an overload of work.
Yeah.
And so with craniosacral therapy, it's about kind of reconnecting the mind and the spinal cord. Is that correct?
Yeah, that's definitely like a part of it, but it's the whole body actually. I actually start at the feet. To like bring in that sense of grounding, and at the feet I can get a sense of the body as a whole, and also all the systems and the fascia, the muscle, like the structural elements as well, and just so even though it is primarily based, it's craniosacral, so from cranium to sacrum, it's engaging with the fluids.
Yes.
So, and it's the fluid, contained in the fluids is the driving forces of our system. So in craniosacral it's called potency, and that is your system's health, energy. In traditional Chinese medicine it would be called qi, or another things prana, but it's those driving forces that contain your body's own ability to heal, and is basically your body's own innate intelligence.
Yeah, I think I read something once that was talking about how at night when you sleep, and often for people with PTSD, particularly for me when my trauma first occurred, the subsequent ones after that, sleeping was really difficult for me, which is such a shame, because you need the foundation of just anything to sort of keep you as balanced as possible. But that is oftentimes something that is removed from the overall balance. And I I had read somewhere that at night your body, it's almost as if you kind of like go through a car wash or a body wash, if you will.
Yeah,
And
that's
there's
right.
fluids that go into your brain and
Yeah.
sort of tidy and clean everything up.
Detoxify.
And then come back out maybe through like your thyroids or your...
Through the whole body,
Yeah.
like even to the point of like there's fluid even inside collagen fibers,
Mm-hmm.
you know, so that's throughout the whole body. There's, you know, it's not just your lymphatic fluid or
Yeah.
the blood or it's just fluid in everything. And but what you're talking about is in the brain there is an area called the third ventricle,
Okay.
and that's what they call it can be described as like the juicer.
Yeah.
And it's where the cerebral spinal fluid basically renews itself, which I think it does about 3 to 4 times a day.
Mm-hmm.
So this is just like a part of it, really, a part of the answer in a way. So with craniosacral, we are listening to the way that the spinal fluid moves up and down the spinal column and into the brain and back down again. It's like a hydraulic system.
Okay.
And so at night, when the brain detoxifies itself with the cerebral spinal fluid, that's happening in the third ventricle in the brain. But
Wow.
yeah,
Can this help with your overall, because I know for myself that one of the things that when I went and saw a dietitian, because I have put on, I think it's probably up to 19 kgs now.
yeah,
Some of that could be down to diet, and perhaps the fact that I'm no longer able to do the sport that I once did due to my trauma. But the overriding factor, I think, that I've been told quite a few times is that I've got fluid retention, that I could be holding on to fluid,
yeah,
not only producing lots of cortisol because of being in that heightened state.
yeah.
So is there any way to kind of combat that with craniosacral therapy as well?
Yeah,
or-
well, I think you know, like we can tend to hold fluid when we are like in that emotional state or a bit stressed, or like it's like protection.
Yeah.
You know, and we're just sort of holding on, and I mean, I definitely get that myself, you know, and absolutely, because it's helping, because it's working with your body as a whole and all the systems, and helping to bring your body back into better alignment, better state of balance. It's promoting well-being. Essentially, it's working with your body's own ability to heal itself. So
Yeah.
you know, if you're going through and doing a series of craniosacral treatments, and then also doing things like in between the treatments to,
Yeah.
you know, like around good self-care, then yeah, absolutely.
That's great.
Yeah.
And what about, I know we were talking a little bit about like kind of the subconscious and the shifts that can happen. What have you seen in your patients that has happened as a result of them having the craniosacral therapy?
Yeah, it's really interesting because if they come and do a course of treatments with me, or I see them, you know, fairly frequently for a little while, if they've been suffering from something chronic, you know, sometimes it can take a few sessions to shift that. Sometimes it can happen quite fast. And if they come in to see me, and you know, we'll sit down and have that initial consultation going through their health history and what's going on for them at the moment, you'll have like a little list of things that are like niggly, or some, you know, from, you know, more extreme and to like little things, and then you come to the end of that course and you ask them, oh, so how's that neck problem or that knee? And they're like, oh, I've forgotten all about that, and it's just like gone away, you know. So right down to those little things too. Also, you know, big emotional shifts as well. Like I definitely see a change in their emotional well-being, you know, once they've done a few sessions, and just their outlook and just everything around in terms of their life like starts to get a little easier. And some kind of come in looking for a quick fix, or they're just curious, you know, but the ones who are really open to the work and who are also, you know, prepared to do a few little things outside of like coming in for treatments, see really good results. But sometimes the treatments just trigger off something in them anyway, that it's kind of, they get that connection to self, and more awareness happening, and that can have amazing transformation. But so that's sort of the emotional, but then there's the physical things like I mentioned as well, like just all of a sudden there's more ease in their body. Physical ailments they've been suffering from have dissipated, they've got better digestion, they're sleeping better, their nervous system, they're a lot calmer, the relationships are better.
So one of the things with PTSD is that it is sort of a person by person thing as well, isn't it? And it is also can be like a collection of things. You might find that something like this really works, as well as perhaps going to a psychotherapist or
going for walks, starting with
yoga,
just changing a few things around nutrition, or and also most importantly is actually mindset changes too, and just kind of giving people I suppose an insight into the fact that they can actually change quite a lot of their reality by sort of changing the story that they've been telling themselves, or by them realising something within a treatment. They might have some kind of epiphany, or it might come after. And just having an awareness to all of a sudden, like an old emotional trauma that might have happened as a child, and just by having that memory come through and the awareness around that and how that's kind of affected their lives going forward, they could actually then start to, because they're aware, start to change that. Yeah, that's right. And so we had talked about how oftentimes the mind and the body can be kind of disconnected, although your body is having all of the, people with PTSD often suffer from chronic pain or weight gain, stress, not sleeping, all those things. So it's just really good to know what our options are. And I just appreciate you having a chat with me about it. Of course. And helping the community know more about this therapy. I just think it's really cool. Like I'm happy to contribute where I can, because it's nice to be able to give back a little bit maybe. Just what you just said before just made me, it's having like certain tools in your kit, right? Yes. To be able to like do some self-soothing and self-healing as well, because it's one thing to come in and have like sessions with a therapist, but more importantly to have some things in your kit that you can do yourself in your own time, because not everyone can afford to come regularly for treatment. And with more alternative or natural therapies, there's no ACC, or the government doesn't subsidise, and that's why I think it's so good to know what your options are. And also I appreciate you saying the thing about the toolkit, because at the end of the day, because of this condition, there is not actually one specific, I wish there was one specific thing you could do and then it would all be taken care of, and you've got a complete reset. You can just move right on. But it's quite an expensive, lengthy process, and so that's why any education we can offer others about what options are, I just think is so beneficial. Absolutely. I mean, like one of the things with what I try to do is just give people a little grounding technique, or like what we call in craniosacral is resourcing. So it's almost like a guided meditation through your own body, or it's just coming out of like having some quiet time and a bit of stillness. But within that stillness, you can just do it whether you're sitting down or whether you're lying on a bed, and it's just going through a little process of like coming into the body through the breath, just noticing how the body's feeling, and almost like giving yourself a little treatment. Well, it is doing that. And actually, if people were to do that even for 5 or 10 minutes, even if it wasn't every day, or the grounding technique, which is super quick, even just those little things can make a big difference. Or little techniques of like, oh my God, I'm like starting to get overwhelmed, or, having little things to be like, right, okay, this is what I can do to help pull myself out of that, and smooth out those bumps and edges, because life is At times it's peaceful and calm, and then at times it can be turbulent, and then throw in a post-traumatic stress syndrome into that mix.
And triggers everywhere. I mean, that's something that's really important as well, is that I know for me, I've often felt a sense of despair because, you kind of feel like, well, your mind got taken from you, your body got taken from you, your whole way of relating to society sort of gets taken from you, and you almost feel like a shell of what you once were. And for some people, and I have experienced trauma in my childhood as well, you don't even remember perhaps what you were like before that, what that version of yourself was. But I mean, with all the research out there, and there's more and more every day, the brain is very malleable, and I'm not 100% there yet with my recovery. I mean, I think it's always a process of learning how to manage it with your toolkit. But the brain is malleable, and you can, just like you were saying, by doing a grounding technique or different things, you can start to rewrite your brain, because actually the functionality that's happening is from the reptilian brain. That's where the fight or flight comes into play. So grounding, breath work can help your body on a physiological level, just like you were saying.
And coming out of the mind and into the body, and that can be, really powerful, and that's how we can start to feel again as well, because, if you've had trauma or overwhelm, sometimes we can sort of energetically leave our body, and because the body is painful, like we get a fright, we come out, and so to bring, that body, the spiritual or that energetic body back into the physical body, and get that kind of sense of more wholeness and connection.
That's great.
Yeah, is that answering the
that's
questions?
Excellent.
Okay?
Yeah, so I look forward to the therapy.
Yeah, cool.
And we'll continue on from there.
And just bringing your awareness now to your breath. Just nice, easy, gentle breathing. Just paying attention to the inhalation and exhalation. And the spaces in between. And each breath you're inviting more relaxation into your body. And you're breathing out any tension or any stress. Quietening and softening the mind, and just coming into your body. And just noticing how your body feels lying here on the table. Just doing a little body scan from your feet up to the top of your head. And we're inviting the body to become more whole, inviting more spaciousness into your system. And we're going to invite in the original blueprint of perfect health, perfect alignment, and perfect well-being. Your own original blueprint of perfect health. How's your body feeling now?
Much more relaxed.
cool.
Before I feel like I had more of an anxious energy. And now
Right.
I feel like very peaceful.
Yeah, cool. A little bit more in your body, eh?
Mm-hmm.
Actually, I'm going to do a sacral lumbar hold. I'm going to get you to lift your bum up, please.
Mm-hmm.
Put my hand under your tailbone. Is that okay?
Uh-huh.
Not squashing me.
Where do I put my
You
arm?
can rest your hand on your tummy or
Okay.
now or your chest or yeah, that's good.
Yeah.
And so what I want you to do is I just want you to really kind of go into that feeling, like that emotion, and just, you know, acknowledging that it's there and just kind of seeing if you can really allow that emotion to surface. Just, you know, in your mind, just thinking, just allowing. And also, actually, what is the emotion you're feeling right now? Can you name it?
To me, it feels like stress, anxiety, agitation,
Yeah. Okay,
maybe
that's good.
anger.
Yeah, cool. So what I want you to do is just really see if you can just allow that feeling to surface. Just kind of surrendering to that feeling. Just wants to be acknowledged that it's there. And yeah, like you say, I think underneath that fear and agitation, or the anxiety, agitation, yeah, there's anger, is there? And so if you're feeling anger, if you can get a sense of that, can you? Where that might be sitting in your body. Do you feel it? Yeah. Where do you feel that in your body?
No, I feel like it's a little bit in my throat.
Anywhere else?
Maybe in my head a little bit.
Yeah.
Up through here, where I can kind of feel the popping, the air pressure getting released.
Yeah. And so just really allowing that anger that's still here.
Feels like it's less here since you moved your hand.
So what's underneath the anger? Without thinking, just seeing if you can kind of feel into that. What is here? What's underneath that layer of anger? Great. And that helpless feeling is the emotion of that is
I don't know, I guess I keep coming back to the fear.
there's something underneath that though. I just want you to see if you can
I think maybe sadness.
That's it. That's like the word I get is like a tremendous sadness. It's like a big crevice here. And that's, I think you've been like really holding that down, protecting yourself from it potentially. Does that sound right? Yeah. So I want you to really just go into that feeling, hon, and just, it's like this, this big crevice between your heart. And I just want you to go right into that and just really allow all that sadness and that grief
and all those feelings of it. It's like it's not fair, almost, you know. And just really allow that to come up. It just wants to be acknowledged that it's here. Just allow yourself to feel that emotion. It's okay. It's, you know, it's time to really just go into this and allow it to come up through your body. Just helping to just set it free so that it doesn't have so much power over you. You're doing really well. It's awesome. It's like changing into more of a like full body feeling now. Like it's really, there's a sense of it really opening up. So just keep on allowing, just breathing into it. What's your chest, old chest area feeling? Take a little moment to answer that if you like.
I feel like the shortness of breath is still a little bit there.
Mm. And any other sensation in that space?
I feel like it's a bit more relaxed than it was.
Mm. It's definitely, it's opened up like a bit more, like especially on the left hand side. But it's like the right hand side of that shoulder just hasn't quite fully come online yet. If that makes any sense. It's just,
Yeah,
it's
I can feel that.
just starting to. And there's like a sense of it just wanting to expand out laterally. So, if I talk about like imbalance for you, what comes to mind? Where do you? Is there anywhere that you just maybe that's not even necessarily to do like emotionally. It's more like within your life, like what's with how your life is structured, or where's the imbalance, or is there an imbalance? Just from your side of things.
Yeah, I feel like there is. I feel like I haven't found something that kind of gives me the joy and the release that I used to have. And I feel sometimes a lack of motivation because it just isn't the same.
Yeah.
So it doesn't feel good enough or worthwhile, or
Yeah.
so then I end up kind of not doing anything, or
Yeah, right. It's like a heaviness there, and like grieving the loss of like the biggest joy that has been in your life, is it? Yeah. Okay, that's good. So kind of just again feeling into where you feel that in your body. Is that the right shoulder?
I do feel it in my right shoulder, but I feel it more in like right now. I'm feeling it more in the bottom of my rib, in my throat, and in my neck right there.
Yeah. I think that's the that's kind of the, well, from your side of things actually, do you feel like that's the kind of core of the sadness?
And when I feel it, yeah. But I do think a lot of it resides in my lower, like with my adrenals and stuff. I think I feel like just fear of everything.
Okay. And what are you most afraid of?
Just the future. What other stuff that is going to be like this lies ahead. If I'm ever going to get better. Sometimes it feels like it's impossible.
Do you really believe that?
Well, I feel like I can't trust myself anymore, so I don't really know.
Do you think that, and maybe that's how you feel at the moment, do you think it's possible you could trust yourself again?
Yeah. And the logical side of me makes that I could get better, but that there's a lot of challenges to get to that point.
What if there wasn't? What if it was easier than that?
I'd be really glad.
Yeah.
I'd be really...
Yeah, that would be cool. Let's aim for that. Let's put that energy in there. Maybe it's not going to be so hard after all. Maybe you're just feeling a little stuck right now in this moment, or have been for a little while, but maybe you've got the ability to change that, you know. And if you were going to change it, how might you do that? And I don't want you to think about that, okay? I actually want you to feel about that. So, I just want you to pose that question to yourself. Like, what do I need? Show me what I need. And just see if you can, like, allow that to come through. You might get something. It might come fast. What do I need? Show me what I need. So what are you feeling here?
My neck.
And throat. Neck and throat, this whole area.
I feel like I can breathe a bit easier.
Cool.